Welcome to SHEP's Pathway to Medicine Q&A session. I'm very excited to introduce our three panelists, Grayson Holiday, Jacob Roberts, and Elizabeth Grist, who will also serve as the moderator this evening. All three panelists are SHEP alums who are at different points along the pathway to medicine, so they are perfect representatives of what this path entails and maybe questions that are on your mind now or some that you should be thinking about as you move forward. With that, I'll turn it over to Elizabeth. And once again, I'm so glad you're here.
Awesome. Thanks so much, Danielle. Excited to be here with you all tonight, either people here in person or watching on YouTube. Like Danielle said, my name is Elizabeth Grist, and I am a rising senior at Washington and Lee University. I'm from Lexington, Virginia, and I'm majoring in chemistry and classics and minoring in poverty and human capability studies. So I, unlike Grayson and Jacob, have not entered into the medical school realm. I have one more year of undergrad, and then we'll take a gap year before going back to med school. So I'm a little bit behind Grayson and Jacob, but I'm excited to have them here with us and to hear about their different journeys and perspectives on medical school. So with that, I'll go ahead and turn it over to Grayson and Jacob, whoever want to go first. If you could just introduce yourself, say your name and hometown, where you went to undergrad and your major there, and then also if you're in medical school or residency, and share what specialty you might be interested in. So a lot of different things, but kind of just give your little who you are and what you're doing.
Sure. I can start. I am Anne Holladay, and I am from Nashville, Tennessee, and graduated from Washington and Lee University this past spring. So I'm also kind of not super into the medical school realm yet, but I'm super excited. I'm going to be starting my first year at the University of Tennessee this fall. I'm actually moving to Memphis next week. So still kind of looking into what specialty I want to do there. I think that's all your questions. Did I miss anything, Elizabeth?
No, that's great. Thanks, Grayson.
All right, so I'm Jake Roberts. I'm from Kansas City, Missouri originally. I graduated from Washington and Lee in 2017. I'm currently a medical student. I'm entering my fourth year of medical school at Johns Hopkins. And like at this point, I've pretty much completed most of my clinical rotations, and I've decided to apply into internal medicine. So I'm going to be applying to that specialty this fall. I'm hoping to specialize a little bit further beyond that to do pulmonary critical care. And do like a variety of things throughout my career, both clinically and with some community involvement.
Great, that's awesome. Well, glad that we have two bookends of medical school, so we'll get a fresh perspective and a little bit more of a maybe seasoned perspective. So, well, moving a little bit just more into our SHEP experiences. I did my SHEP experience 3 summers ago, summer after my freshman year. And I knew I had to do my SHEP experience for my poverty minor. And it was something freshman year. I was like, I just want to do something generalized. And so I ended up interning with Bowery's Residence Committee in New York City. And I was a homeless outreach intern for them. So my SHEP internship had actually nothing to do with healthcare, but I decided to do it because I wanted to see how to interact with patients who are vulnerable and in high-risk situations. And from that homeless outreach perspective, I've been able to transfer that into kind of my medical career and pathway. So I just would love to hear from you guys what your SHEP internship was and why you wanted to do it, and any takeaways that you had from your own experience.
I can go first since I went last time, or the time before. So I did my SHEP internship back in 2016 in summer. I was a poverty minor at WNL. I think I froze maybe.
There you go. You're back. Yep.
I think I froze there for a second. So I was a poverty minor, and so I needed to do an internship for part of to complete the minor, but was also really interested in doing it just for some of the experiences that I could gain from it. So I did my internship in Charleston, West Virginia at a hospital there called Charleston Area Medical Center. And in an internship role, I was with the social services team, so with the medical social workers, and we worked on discharge planning, worked with some of the charge nurses and others for figuring out plans for what we do when we send patients home and making sure they were connected to the right resources, that they could get ongoing care, go to the right facilities if they needed things like rehabilitation, and making sure that they were connected with everything they needed, including things like insurance if they came into the hospital without insurance. So I really gained a lot from that experience and learning more about the social side of medicine and seeing a lot of the limitations of medical treatment if you're not addressing the real underlying causes of a lot of people's illness, disease, and just how complex their medical problems can become as a result. And I felt like I gained a lot from that, not only like in being able to evaluate patients and like communicate with regarding some of these special areas, and knowing how to communicate with the team in particular that handles most of those problems. Because a lot of times as the doctor, you're part of these discharge planning teams, but you're not necessarily always the one following through on that. So you need to be able to know what information to provide your teams. I felt like I gained a lot from that, and it's helped me a lot in medical school when I'm talking with patients, figuring out why they have a medical problem, having them come back to the hospital over and over, and has really helped me understand the discharge process a lot better and making sure patients have the right setup when they leave.
Cool. My internship experience was pretty similar in some of my takeaways. I think I was a member of the 2019 Shepherd Summer Internship Program, so the same year as Elizabeth, actually. And I worked with the Camden Coalition of Healthcare Providers in Camden, New Jersey. And I did the internship because I'm also a poverty studies minor at Washington and Lee, so it was also required for the minor. But I really wanted to see how my academic interest of poverty studies and science and medicine kind of overlapped in the real world space of healthcare, and to see if I could picture myself working in that space. And I got a great experience at the Camden Coalition, spending my first month largely in the emergency room setting, and my second month largely in the clinic setting, doing work similar to what Jacob described with looking at like ER utilization and how different social factors affect the hospitalization process. So I helped administer social determinants of health screenings in which I asked patients about their housing, their transportation, their access to food, and kind of helped these patients connect with some local resources if they indicated a need. So my biggest takeaway, similar to Jake's, was that medicine is so interconnected with other dimensions of society and well-being. In my work, I interacted not only with the interdisciplinary team of healthcare providers, but also professionals that worked in housing, food insecurity, transportation, medical legal services, et cetera. And I was really struck by the dangers of practicing that siloed medicine, or in other words, kind of recognizing that medicine is going to extend far beyond the examination or operating room into the spheres that we live, work, and play in. And as a future physician, I knew I would be really missing part of that picture, like Jake said, if I neglected kind of those social factors that might affect my patients outside of the imminent physical or medical conditions.
Yeah, that's awesome, you guys. Thanks so much for sharing that. I think I experienced that a little bit in my internship. This summer, I'm actually doing more of a medically oriented internship in addiction services. And that has really been, I think, this summer, my biggest takeaway of, we have these weekly meetings where there's a nurse and a counselor and a psychologist and a psychiatrist and the addiction services physician all sitting in on this meeting. And we literally go through a list of all of our patients that we've seen this week, and we talk about them and, okay, they mentioned this to me, so maybe, the therapist needs to talk to them about that, and kind of this collaborative, communicative conversation that every single one of those providers takes an hour out of their week to sit down and just talk about those patients. And that, for me, I just sit there and listen to those conversations, and that has just been so eye-opening to me, just showing the interconnectedness of especially patients who are experiencing poverty, just like Grayson said, those social determinants of health that really just kind of are these confounding factors of an experience of any kind of illness or sickness that patients are experiencing. So kind of facing turning more towards your path to medicine. We're all kind of at different phases, but I would love to hear from each of you why you are interested in pursuing a career in medicine, and kind of how you kind of started and where you are now. So what made you, as a freshman in college, or even, in high school, whenever you decided, what made you decide you wanted to go into medicine, and kind of where has that led you now in your passion and desire to go into healthcare?
I can start with this one. I think I came into college on the pre-med track more because I didn't want to close that door, rather than I knew I wanted to walk into that path. I'd done some shadowing in high school and thought it was really cool, but have no one in my family that's in the medical profession, so didn't really know much about it. And just found myself really interested in my poverty studies courses at WNL and loving the science courses that I was taking on the pre-med track. So I knew I needed to do some shadowing and kind of figure out, is this what I want to do, or am I just here because people are telling me I should take these classes now if I ever want to be a pre-med? And I did this Shepherd Summer internship, and this for me was really where I started to envision myself in the healthcare space, because I saw that medicine has a potential to interact with a lot of different social issues that I care a lot about. And I see a lot of potential in medicine to be able to advocate for patients and communities. And though there are a lot of different ways to advocate for individuals, I found that I just really enjoy the field of medicine. I really enjoyed shadowing doctors and can picture myself in that space. And I want to be able to meet patients in a vulnerable state and kind of respond with the compassion, trustworthiness, and level of care that you hope to find in a doctor. So though I have a lot more to learn, I'm super excited to begin my medical school this fall.
Exciting. I think I kind of had a similar thought process in deciding to pursue a medical career. So I entered college as a pre-med student, thinking I would apply to medical school at the end. And kind of what initially drew me to medicine, I was an athlete, so I actually played soccer at WNL and ran track as well. And kind of the sports side of medicine is what drew me in. And I used to shadow orthopedic surgeons and thought I'd go into kind of a sports medicine realm. But really my thoughts about medicine grew a lot deeper through the poverty program. Being a minor, thinking a lot more about the social issues of medicine, I started to think a little bit more critically about the underlying social issues overall in medicine, and had a lot of interesting coursework in cultural anthropology, medical anthropology, and breaking down a lot of disparities in healthcare as well. And being able to do a summer internship through the SHECP program really opened my eyes to some of the issues, and I really wanted to become active in that and become an advocate for people who are in the most need and work with vulnerable populations. And I was very interested in things like global health and as well through kind of that growth over time. And that continued to really grow. And I found that in medicine, it really kind of encompassed a lot of things I loved. I've always enjoyed multiple subjects in school, and in medicine, you really know science really well, but you also really know social sciences as well. And it really combines every possible field together, and knowing how to interact with very different types of people and gain trust, but also thinking critically from a medical perspective about what's going on, how you can treat a patient medically, but also treat them as a person as well. And my internet, I think, just froze again. Oh, my back. Okay.
Yeah, you're back.
Okay. So for me, medicine was really just the interdisciplinary nature of it, where it combined a lot of different ways of thinking, was what really drew me in and finalized my thoughts and confirmed that I wanted to pursue that path.
Yeah, absolutely. That's really insightful. I think something that both of you have pointed out that I'm learning this summer as well is, like you said, Jacob, the interdisciplinary nature of practicing medicine, right? I think watching my physician that I'm shadowing this summer doing a million different things at once. And I think of this imagery of, right, like she looks like a duck just gliding across the water, but her feet are paddling really fast underneath, right? Like I'll see her outside in the hallways or in the provider room running around, and she'll walk into the room with the patient and she just has this calm demeanor, and she gets right next to the patient and has this caring conversation, listens to what they say. And I think that's just a really cool way. So I guess I'm saying this for anyone who's kind of on the fence of, should I go into medicine? Should I not? Something that I think has been helpful for me is thinking about, like, what would the day in a life look like for a physician? And I think my advice to that is get in that situation as much as you can, shadow as many doctors as you can, and really experience that. And from that, you learn how to interact with patients in a way, hopefully, that's caring and person first, that really respects the individuals that you will go on to serve. So yeah, thanks guys. That's really insightful. My next question for you guys is, what have you done to prepare for this career path? And maybe a little spit on that too. What would you maybe have done differently if you could go back to college or even before college?
I guess like the path for me now that I'm a fourth year in medical school has like changed a little bit over time in terms of like what I've preferred to do and targeted towards like getting me into the future steps of where I want to go. But in terms of like things I did in college, is I did a lot of research as well in basic science type work. I worked in a lab throughout 4 years, did a lot of work in that regard, but also did a lot of stuff outside of that with like college athletics and volunteering a lot. And just like really what I did most, I think, was I had not so much like a ton of different things, but committed very hard to like a few things and really got involved and carried those things with me throughout college. So it was different items I could grow with. And I felt like that was something that helped me when it came to applying to medical school, because those were things that I became very passionate about and could really talk extensively about. And my people who interviewed me and like read essays I wrote could really tell that like these were things I spent a lot of time with and was really committed to, and showed that I could commit to something and work to improve things and just progress and gain as much as I could from an experience. And I think that's really what a lot of times they look for when you're applying to medical school, and that's helped me along the way. But some of the same things have carried over to medical school for me too. There's like right away when you start med school, there's so many things that are thrown at you that you get involved with. There's so many different things you become overwhelmed with like volunteering or like research or like doing different things in the hospital and different organizations through the med school. And you kind of like pick and choose over time and figure out what you really value the most, and that kind of guides you towards like what your next steps in your career are, and you learn to figure out what things that you want to prioritize. And it's kind of overwhelming at first, but as you kind of narrow things down, it's pretty cool. But some of the same things I did in undergrad with like volunteering and continue doing a little bit of research here and there, but really just mostly trying to put my efforts towards like a few things that I really care about and growing that way.
That's really good advice, especially as I'm about to head into that first year. I love to try to think that I can do everything sometimes, and I definitely can't. And I think I learned that more through college as I've started to hone in on just a couple things that I'm really passionate about, but knowing that I'm about to be overloaded for sure in the next couple of weeks, that's a good thing to continue to keep in mind. I think for me, similar things to prepare for med school. I wasn't as research minded. I definitely focused more on my extracurriculars, volunteer work, coursework, doing the standard things like studying for the MCAT, applications, interviews. That's all pretty fresh on my mind right now. But yes, like Elizabeth said earlier, getting in the presence of physicians and learning about how their day-to-day life looks, that was a really big thing for me. Shadowing, whether that be in a primary care setting, an ER setting, or operating room, just getting exposure to a bunch of different fields of medicine was really important for me, because medicine is so big and there are a lot of different avenues that you can take with it, which I've started to learn, but I know I've only scratched the surface of. So definitely shadowing was a really big thing that was helpful for me as I began to think through medical school.
Yeah, absolutely. I think for those of you who I still experience this same kind of crisis when somebody's like, oh, what kind of medicine do you want to go into? And I just kind of freeze. I'm like, I don't know. And I don't know about Grace Ann, if you really, have a definitive answer to that, but to anyone going into medicine, that is okay. Like, you don't need to know exactly what you're going into when you go into medical school. I'm not even in medical school. I'm sure Jacob could speak to this more so, but again, just like getting in the presence of doctors is really, really helpful. Also, Jacob, to what you were saying a little bit, the best advice I think I've gotten so far on my path to medical school is pick a story and develop it. Like Jacob was saying, you can't, and Grayson, you can't do everything, you just can't. And I know, especially students on the path to medicine want to do everything because we're passionate. We care about people and we care about the communities that we're in. But really just, I would say, pick a few things that you really care about and that develop a story for you and that you can kind of continue to build on your way to medical school. We'll see if that works for me when I apply to medical school. I don't know, but when I'm trying to choose, what do I prioritize my time with, that has been helpful in making those decisions. So
I kind of like to echo too, like you definitely don't need to know what kind of medicine you want to do when you start medical school. And even during medical school, you could be entering your 4th year and not know what you want to do and change your mind 100 times like I did. Like I entered med school wanting to be a pediatrician, and then I really loved adult medicine. And so I've completely flipped, and like along the line at some point I wanted to be a surgeon, and now I definitely don't. And so it changes all the time, and you don't have to write your story entering med school telling people exactly what kind of doctor you want to be. You might know what kind of doctor you want to be in terms of how you want to treat patients and as like a person, and that's to me I think more important than knowing like I want to be a neurosurgeon or something. So.
Yeah, absolutely. So I guess we just kind of asked this, but well, maybe more. Let's do this. What are some of the challenges that you guys have faced on this path to medicine? And kind of in light of those challenges, what advice would you give?
I think time management, kind of like what we were talking about, has been a big one for me, trying to figure out where do I prioritize my time and how do I do the things that I really want to do and am passionate about, but also be sure that I'm taking time for myself too and rejuvenating myself in order to fully invest myself into different, schoolwork or whatever it may be. One of the biggest challenges I think that I faced, which hopefully won't be an issue for any of y'all, was COVID made it really hard to get shadowing hours in. My MCAT was delayed. There were several different logistical bumps in the road that I had to face this past application cycle, but hopefully that's starting to go away for the rest of y'all. But advice that I would give, I think in light of that, just do what you're passionate about. Definitely think about your story and what makes you tick. But I think medical school can be, when you're thinking about it, can seem like a lot of check boxes of things you have to do, courses you have to take, shadowing hours you have to fill. And yeah, just do what makes you passionate. Don't do anything to try to fit the resume. That's probably a little cliche, but you're going to want to do something that's sustaining and something that you're excited about. And the rest will kind of fall into place. Obviously, do the things you have to do to apply to medical school, but be sure that you're doing things for the right reasons as well, if you can.
Grace Ann is not saying don't take the MCAT.
You have to take the MCAT, unfortunately.
Yeah, so I think for me, what's like most recently on the mind is just my experience last like in medical school in terms of those challenges. So like starting clinical rotations during a pandemic was obviously a big barrier, I think, and something that there were a lot of changes and adjustments you had to be adaptable to early on. Like when we were rounding with your team and going through the patient list, and half the people are in one room, the others are in another room, and you're presenting on like Zoom rounds, and it was just like an odd setup at times, and just adapting to all these new rules and changes was very interesting, but I think will be helpful in the future as we continue to incorporate like technology into patient care. But Beyond like pandemic related stuff, I think like the biggest issue many medical students face is feelings of burnout and comparing themselves to their peers. I feel like there's a lot of pressure that you need to do a lot of things in medical school to keep up and be compared to your peers, but in the end, it really doesn't matter what you're doing and what like somebody else in your class is doing. That you should really never really compare yourselves, and just the aspect of it being such a long journey too. People get burned out all the time. Sometimes you do rotations where you feel like you're not being like listened to or getting a whole lot out of it, and you're kind of feel like you're not doing a whole lot. And even during like preclinical years when you're having to study so much and like takes a ton of exams and you're always just being overloaded with information, it can be a little bit overwhelming at times. And for me, it's been important to just kind of like step back a lot throughout the 4 years and think about what I really care about the most, what I'm passionate about, and reflecting on what kind of doctor I want to become, and then prioritizing in that regard, and just being able to step back and realize it is a long journey, but I did it for a reason. And having certain moments that I reflect on when I interact with patients in the hospital, like those are the things I went to medical school for. And some of those are like very just like beautiful moments when you like reflect on them, and just trying to value each stage of the process you go along, because it's definitely a long process, and sometimes medical students aren't always treated the best, and you kind of just have to put your head down and work through it sometimes. But always making sure that you're reaching out when you need support and stuff is always important. But it is a long road, but he says it's worth it in the end.
Yeah, absolutely, Jacob. That's really insightful, and kind of leads into my next question. And you said a lot of great things of, it's important sometimes to take a step back and look from a larger perspective. And sometimes you just have to put your head down and do it. But what advice do you guys have for some self-care strategies? Like you were saying, Jacob, for anyone, I'm sure some of us even experienced that this summer with virtual internships or virtual school this past year. What are some of your self-care strategies that you would give for advice?
I can go first this time. So for me in medical school, I just found that my like well-being and overall wellness definitely depends on the kind of balance that I'm maintaining in my day-to-day life. So I try to just prioritize the things that I matter the most to me, and I know that will help me to feel good. And it's even like little things like making sure you're eating well and like eating like outside, because sometimes you don't have a lot of time, but if you can like figure out a plan where you're like, maybe cooking on a certain day for like several days, or just like making sure you're eating well, it always helps. And for me, being like a college athlete and running and working out all the time, I try to continue running and like still try to sneak in like different competitions that I'll race in every once in a while when I have the free time. And it's like fun to have those little things on the side that aren't medicine, and it helps you keep that balance in your life, so you're not always being overwhelmed and feeling like you're just kind of having to work all the time on these very specific things. But the day-to-day too, when you don't really have a lot of time, like I kind of mentioned earlier, is just being a little bit more reflective day-to-day too, and finding out and thinking about what it is that you're enjoying during those days, and noticing the little things, and also recognizing your progress too, because sometimes it feels like you're not getting anywhere, but if you take a step back and realize like a month ago you didn't know like all these things that you recently learned, and that you are able to do so much more in the hospital at that point. And even from like the beginning of med school, it's crazy how quickly you pick up on information and gain different skill sets. So it's just, I think the little things, if you don't have time necessarily to like go on a long run or like cook an amazing meal or something, just being able to take a step back throughout the day and think about that stuff. And so for me, like balance is really important, and that's been something I've been prioritizing too, as I consider like the specialty that I'll go into practice in, knowing what I want to have ongoing in my life along with my medical practice.
For me, I think being around people really rejuvenates me. So spending time with family and friends, whether that's going out to dinner. My cooking skills probably aren't as good as Jake's from the sound of it. Hopefully that will improve as I go off the beloved WNL meal plan this fall. But yeah, whether that's going out to dinner with family and friends or just relaxing and talking, I really enjoy spending time with people and kind of stepping away from schoolwork, whatever that looks like. I also love being outside, so going on walks and hikes and talking to people on the phone while I walk. I'm a big pacer when I'm on the phone. Just being active and getting blood flowing is a good thing for me.
Yeah, those are all really great tips, and everyone has different things that work for them. And so I would just encourage anyone listening to this to just, find the one or two things that really are a relief for you and kind of lean into that when you feel like you're getting in over your head, for sure. So turning a little bit more towards, I think a lot of these listeners will be coming off of their internships and thinking a lot about civic engagement and how does your career intersect with, caring for people living in poverty. And so I would love to hear from you guys how you would describe your approach to civic engagement. I think I've heard it say before, there are 3 ways you can get involved in caring for people who are in vulnerable situations, and that's financially, right, donating, and then the next one is volunteering, and then the third one is through your career. And obviously in the career of medicine, there are a lot of opportunities to really care for people in vulnerable situations. So I would love to hear from you guys what your approach is to civic engagement in and outside of the medical world.
I think for me, I'm still figuring that out for sure, particularly in the medical space, seeing as I'm just now about to start medical school. And I think a big part of me really enjoys the hands-on direct approach to civic engagement. Maybe that's because that's what I know the most in different hands-on volunteering activities. And I definitely hope to find that in the clinical side of practicing medicine, just being with patients from a practicing clinical physician standpoint. But I think a part of me too is also intrigued by the prospect of maybe working from an institutional level change, which is largely inspired in part by my Shepherd internship, because that second month I was in a clinic working with hospital administration on how can we better address social determinants of health with all of our patients. How can we create like a systems-wide approach to connecting our patients with resources? And I found that I enjoyed that a lot more than I thought that I would. So part of me not only wants to do some of the like clinical hands-on approach, but maybe to work in hospital administration someday to think about what does civic engagement look like at a systems level. But again, that's all just thoughts right now. So still a lot more to figure out in the future.
Yeah, I definitely feel like civic engagement is like an important part of what I've done in medical school and kind of what led me to even pursue a medical career. So I've really tried to get really involved in the communities where I am. Johns Hopkins, we're in East Baltimore, which is an area that's very much impacted by poverty and a lot of social and economic issues. And I've tried to get as involved as possible in different areas. So it's different things I've done, especially during the preclinical years when you don't know anything really as a clinical provider in any ways. For me, the way to give back to the community was to get involved in other ways. And I always felt like I had great like mentorship that helped me and supported me to get to the point where I was a medical student. So I kind of wanted to give back in that way. And I spent a lot of time where I actually ran an after school program for high schoolers from across the street, where we had all these guys come over every Wednesday to the med school building, and we would teach them like a science lesson, or we do just like career development or some other mentoring project for an hour. And then we spend an hour in the gym playing basketball with them. But it was a way for them to meet medical students and learn about what we do and how we got to medical school, and then any advice we could give to them for whatever career they chose, if they wanted to go to college or start working right out of high school, and offer support any way possible. And for me, that was the most rewarding part of the first 2 years, like not being in the hospital, but being able to work with people directly in the community and hopefully give them some ideas of what they can do with their futures and help them along the way. And that was like pretty great experience. And as a medical student on the wards, you don't have as much time necessarily to volunteer outside the hospital. But for me, it's been more on an individual level, where a medical student, even when you're like doing your sub internship where you're acting like a first year resident, you still don't carry as many patients on your list as like a typical resident. So you have more time to spend with your patients and interact with them and really get to the root of some of their issues and really build rapport with them. And I feel like I've always tried to take as much advantage of that as possible to get to know my patients and make sure I'm really helping them. And I felt like at times that has really impacted patient care, where these patients are leaving the hospital in a much better spot than when they came in. And a lot of times it's having a medical student on a team can actually really help patients and improve their care in the hospital, because the medical student does have more time to interact and often is closer to that point in their career where they are like very enthusiastic about these kind of things. So it's like fun to be able to impact patient care in that way and be an advocate for patients. And I've noticed like skills I picked up on the SHEPP internship have translated as well. And like in evaluations on different rotations, I've noticed that like people have taken note of these kind of things and they comment on that. And it's really helped me to progress throughout medical school. And kind of moving forward for like career planning, like I've decided I wanted to be a pulmonary critical care specialist, which essentially is a lung doctor who also specializes in critical care, to spend time in the ICU. And for me, I really like the ICU because the disease complexity is like incredible. There's so many things changing all the time, and you see different things change throughout the day as you create different interventions. But it's also a great opportunity to connect with families and learn more about patients and what they value in their care. And there's a lot of just like very moving conversations that occur in the ICU as well. And from the pulmonary perspective, a lot of times you can do like outpatient clinics and things like that. And for me, the pulmonary side is more for a community advocacy standpoint. So I'm trying to get involved in a lot of projects in the community for preventative health, and starting to work on some projects where we educate on clean air with actually younger children and get them certified and as advocates to their communities on how to promote cleaner air and housing in some of these neighborhoods where it's not always available, and talking about preventative things like not smoking and working in tobacco cessation clinics. And so now moving forward professionally, thinking about how I can do that in my career and outside of just like the volunteering and advocating each day with individual patients. So it's kind of like a moving thing. And then as you go through different stages of your training, you kind of figure out how you can get involved in different ways.
Yeah, absolutely. I think you guys both make really good points that civic engagement is kind of a lifelong pursuit and that it changes in different stages of your life. And so I think you guys both offer really good perspectives of starting medical school and ending medical school, right? And for me in college, civic engagement looks different in every step. And just because you're in a different stage of life doesn't mean that you have to stop civic engagement. You might just have to look for it a little bit more. It might also just fall into your lap. So yeah, thank you guys for sharing those perspectives. So I have one more question tonight. It's a little cliche, but I think it's an important way to end a conversation for people who are just interested in medicine and might be on a lot of different paths or even wavelengths or different contemplations on whether or not even to go into medicine. So I would love to hear from you guys just what you wish you would have known before you embarked on this path, and any advice you would have to somebody who, what advice would you give little Grayson or little Jacob in, 5 or 6 years ago that you would like the listeners to hear tonight?
I can start with this one. I think part of me, if I'm looking back at like early college, I think I looked at a bunch of my friends in the business school and was really thankful that I didn't have to do all of the networking that they were doing, because I was going to medical school and not trying to be an investment banker. And I kind of wish I'd realized sooner that it's actually really valuable to talk to current professionals or current med students, doctors, whatever, because they have a lot of wisdom and guidance to share. I've learned so much from Jacob, even in the course of like this call, to take with me as I start in a couple weeks. But yeah, I think I would just advise myself to really reach out and to learn from different alums and current positions about the work that they're doing.
Yeah, I think definitely networking early on is something that is important. I like didn't do a great job of it as an undergrad and didn't know that many people in medicine. I was the first person in my family to go to medical school, and now my younger brother is a medical student at Columbia. Actually, he went to WNL as well. But that's definitely important. I think the other important thing too is to make sure when you're applying to medical school, you're really trying to find your fit. If you have the opportunity to be accepted to more than like one medical school and have options, to make sure you're really considering fit. And like things like proximity of family and in the culture of the place, because I think that's really important. And sometimes you may end up somewhere that isn't like a great fit personally. And I mean, even if that does happen, like things are okay. Like, yeah, it doesn't have to be perfect, but just considering some of those things, at the end of the day, like it doesn't matter like the name of the institution you went to or like where you went. It's kind of more of just what you did while you were there and how you made the most of your time. You'll get great training anywhere in going to a medical school in the United States, and just making sure that you find the right fit. And that's something that I have really gained a lot from on thinking about as I start applying towards residency and thinking of like what kind of environment I want to be in, and making sure I'm going somewhere where the things I value are especially valued there. I think that's important. And then also just to like never like try to compare yourselves to your peers. Everybody's on very different paths. Everybody's gotten to medical school in very different ways, and there's so many specialties that people are going to choose from, and there are different things you have to prioritize to go into different specialties. And so there's really no sense in comparing yourself to others as a pre-med or in medical school. So it's really just your own journey, and you'll get there. And don't stress about what you see other people doing. So I think that's sometimes something people get overwhelmed with at many stages.
Yeah, absolutely. Comparison is the thief of joy, right? That stays with you for probably lots of stages. Well, on both Grayson and Jacob's notes, please reach out to any of us if you have questions about anything medicine related or pod related, or just any questions about different stages in the path to medicine. We would love to have that conversation with you guys. I'm speaking for Grayson and Jacob. I'm assuming that they would agree, just speaking to the importance of networking. But yeah, thank you guys for taking time to listen to this, and I hope it was helpful. But again, yeah, don't hesitate to reach out to any of us.